Hello, everybody, and welcome to this very special Noon World Menopause debate. I'm so thrilled to have such a fantastic panel with us today and to have so many of you joining us. It shows what a really important topic it is. And we've really got some of the trailblazers here today. I'm so proud of all these incredible women who are joining me because it really is, these really are the women who have put this debate on the map. So for those of you who don't know, I'm Eleanor Mills. I'm the founder of Noon, which is a new platform for women in midlife. And the title of this debate is about how do we have a more inclusive conversation around menopause. And that I think has really been thrown into relief recently by the latest statistics which came from the National Health Service, which showed that although there's been a massive uptake in HRT since the Davina McCall documentary. Thank you very much, Kate Muir, who you can see there, who's the producer of that, and has set that whole ball rolling. And there have been like 500,000 more women who've got HRT since. They're calling it the Davina effect in the health service. But the take-up is there are twice as many women in the richest areas of the UK getting it as there are in the poorest areas. And when it comes to women from different kinds of communities, again, we see a huge disparity in information and kind of knowledge. So what we're going to be really trying to tease out today is how do we move the dial on that? How do we change that? And what are some of the things that our amazing panel can come up with. So I'm just going to introduce you to everybody. So we have Jennifer Howze, who is the Editorial Director of Netmums, which serves a really kind of broad spectrum of women, and one where it's really important to broaden the debate. We've got Tina Backhouse, who's the General Manager of Theramex, who are some of the people who actually distribute HRT and make it and get it out there, and who's an amazing fountain of knowledge on everything HRT and menopause, and we love Tina. Thanks for joining us. We've got Anita Powell, who is a brilliant community organizer and community nurse who works in Bedford with lots of disadvantaged communities of women, and is really passionate about kind of broadening this debate out. We've got the indomitable Carolyn Harris MP, the complete like parliamentary warrior for all things menopause, who's like a global champion of all things menopause. Also, thank you, Carolyn, MP for Swansea East, a complete queenager icon, I think. Thank you so much for joining us. And the amazing Kate Muir, who's an old friend and compadre of mine from when we both worked at the Times, who is now a super menopause champion herself and was the producer of the incredible Davina documentary, which has done so much to change the landscape and did all the kind of research and producing and kind of a lot of the thought leadership behind that. So Kate is an amazing writer, brilliant journalist, fantastic woman. And we've got Yasmin Alibhai Brown, who is was the first Black Muslim columnist to ever work on a British newspaper. I'm very proud that she also was a columnist on the magazine that I used to run. She's also a dear friend, fantastic spokesperson on all of this stuff and everything about how communities are kind of marginalized and how we raise different kinds of voices. And this is something she and I have talked about for a very long time. And then last and by no means least, we have Andrea Berchowitz, who is the founder of Vira Health, who's setting up an incredible app for all things menopause called Stella. And is of a kind of slightly younger vintage, I think it would be fair to say, and is really passionate about how we can use technology to advance this debate so that for the next generation of queenagers, things are not so tricky, and there are different ways of trying to reach out to people and getting them the medicine they need. So I think you'll all agree that it was a pretty amazing lineup, and really proud to have you all here. And Kate, since you were the very first kind of person who got all of this going really by kind of getting Davina out there, and do you want to, and she's also written a brilliant piece for my website Noon about her own experiences of menopause. Do you want to just kind of kick us off, Kate, with why you started talking about this, how the Davina thing got going, and then I'm going to come to Carolyn for the kind of parliamentary view.
Well, yes, thank you for having us on. I'm really pleased that we're having this conversation right now, because we're kind of 3 years into the menopause movement, thanks to really Carolyn and so many menopause warriors from Menopause Matters, Diane Danzebrink, all these people. There's basically a sleeping army of Amazons who have risen up, or the Generation X Amazons. And I'm very aware of this great kind of huge support that we're all sitting on, and it's so inspiring. But I also think, because it's a new movement, unlike sort of early feminists and early this and that, we really can think immediately about being inclusive, which I think a lot of other movements didn't. And you know, I came from being a film critic, where late on we got Oscars so white. We do not want menopause so white, hashtag. I think it's incredibly important. And I think it's incredibly important that we get, I mean, my own menopause was a car crash. You know, I found out about HRT, didn't know, you know, about it being safe, the new body identical HRT. And I think that message of evidence-based information on the new body identical HRT is one of our massive messages. And we did, I helped write the poll for the Fawcett Society, which we did for the Channel 4 Menopause documentary. And in that poll, we checked to see what white women, as opposed to women who were not white, were doing with HRT. It was 15% white women on HRT, women who were not white, 8%. And we also surveyed that chunk within our, and it was a properly diverse, you know, poll from Comres. And we found that Black women and Asian women going to their GPs were going back 4 times to get things, and disabled women, it was much more of a struggle. And so it's bad enough, right, trying to get HRT and trying to get sorted, or trying to get some alternative that really helps. But that double burden or triple burden is absolutely clear to me. And there's one other thing, which is there's a study at Warwick University a couple of years ago, and it's about poverty. And if you're in a poor area, as you said before, Eleanor, you are 1/3 less likely to be offered HRT. You're much more likely to be given antidepressants. And of all the people in all the world who need HRT to just give them a lift, it's the people who are going to be suffering from fuel poverty and everything this winter. And they are not going to be sitting, changing their diet and going through a yoga class and having time to think about their nutritional needs on the Zoe app. They are going to be struggling. And anything we can do right now, tomorrow, to get the message out, I think really matters. And that's me.
Okay, thank you so much, Kate. Carolyn, I'm going to come to you, because I came and interviewed you. I was going to come to Swansea, and then we ended up doing the interview on Zoom. And you said something to me which has stuck with me ever since, and is actually the kind of germ of this whole kind of campaign. And you said that you'd been to, oh, you tell the story, so it's your story. You said that you'd been to see some shop work, to talk to some women who worked in a shop about menopause.
Yes. Well, I mean, just to tell you a little bit about my background, before I became an MP, I worked for an MP, but way back in the way back, I was a dinner lady and a barmaid. So I come from that side of society who would not be able to afford to go private. And I lost my son in 1989 in a road accident, and after coming out of a very, very dark place, I went to university when I was 34. I got a degree. I ended up in jobs, you know, fairly well-paid jobs, and then all of a sudden, I was pregnant again. I was 41. I had Tom. 2 years later, I'm pregnant again. Weird, but this time it's an ectopic pregnancy. So I went for the next 7 years having really erratic periods. In 2010, I hemorrhaged constantly for 6 months, really, really badly. And ended up, eventually went to a doctor and eventually got admitted to hospital. And before they could do anything, they had to give me intravenous blood and iron before they could even do any explorations. But what they discovered was massive fibroids. Had the fibroids removed and I never saw it again. And I tell you that because I don't know when my period stopped and the fibroid started, because I was 50 when that happened. When I came out of hospital, being very, very fragile, both psychologically and physically, I just spiraled into a depression. And I rationalized that because I'd not allowed myself time to think about losing Martin, and because I hadn't allowed myself to be able to grieve properly, because I was terrified to stop and think about it. So it was push, 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 university, work, that I was then grieving. So I went to my doctor and told my doctor that I had a nervous breakdown, and I ended up on antidepressants. I never told him that I couldn't sleep at night because I was too hot. I never told him that my legs wouldn't keep still. I never told him that the pains in my thumbs and my wrists and my knees. I never told him anything other than, I'm having a nervous breakdown, you've got to help me. And I was on antidepressants for 8 years. And I was in this place, I was actually an MP, and we would talk about menopause every International Menopause Day. I instigated those debates. I had groups coming in like Diane, like well, Menopause Matters, and we had Positivity, and any group that came and said to me, we want a platform, I'd say, come in, we'll give you that platform. And I spoke about all the women out there who were having a really tough time getting diagnosed and getting prescribed. But I wasn't one of them, because I sailed through my menopause. I didn't have a menopause. I was rare, you know, it was easy for me. And it was only 2 years later, after I'd been talking about everybody else's menopause, that I sat down and had a conversation with people and realised that I'd been menopausal since I was 50. Purely because I didn't come from a background that one could afford to be menopausal, because we didn't have the money to go and pay to have a private consultation. We didn't have the time to go to a doctor. The doctors weren't recognising it anyway. So we all had depression, anxiety, insomnia. We all had fibromyalgia. We all had early onset dementia. And friends of mine have said to me, I did loose women a couple of months ago and said that I was menopausal and I was on HRT. And friends of mine actually said, you were posh having a menopause. Every single one of them had had at least one of the symptoms of menopause. But we all sailed through it. We were all doing it for everybody else. It was so, you know, and I didn't go on HRT till last year, and my life has completely turned full circle since I've taken HRT. But I think what I'm saying is that whatever happens, our mission has to be to make sure that every woman in the country has access to the right support, the right treatment, the right medication, and most importantly, the right information, so that she can make the choices about how she gets through the menopause. And that's my mission in life through politics, is to use my platform to talk up everything that we need to do, and to make sure the people who make the change, the people who can legislate, the people who make the decisions about how women are treated, regarded, how women are looked at and perceived, that every woman has the respect to be allowed to live her best life, because we have provided her with the resources to do that.
Oh, thank you, Carolyn. That's such a moving story, and also how amazing that you did all that campaigning and you hadn't actually related it to yourself. And I think that that's so true of all of us, that we kind of read about it and I remember Dr. Nigat saying to me, okay, these are the symptoms, and thinking, oh yeah, actually, you know, I do have really sore breasts, or, you know, all the things which I hadn't really kind of thought were part of it. Anita, I want to kind of hear from you now about what you see in Bedford with the, you know, the kind of women that Carolyn are talking about, and some of the problems that you see, and also some of the things that would help from your point of view.
I think one of the things, because I've been talking about menopause in public spaces for about 3 or 4 years. Oh, sorry, my boss is calling me. What a bad time to call.
If you want.
No, sorry. Doesn't happen now. Yeah, so I've been talking about menopause in public spaces for about 3 or 4 years, and I found when I started, because I didn't know anything about menopause, literally nothing, but I felt actually we need to talk about this, and I'll give you an example of why I realised we need to talk about it. I was a community worker at the time doing a support job where I was helping women who'd been out of work for a long time get back into work. Now, I was working with a lovely Sikh woman who was in a homeless shelter, And what happened, she was in her 50s, and basically she was suffering from what apparently was depression, and her husband kicked her out of the home, and the children disowned her because they thought she was going mad. Now, her joints ached, she was sleeping all day, she was crying all day, and she ended up homeless, which is I don't often see Sikh women in homeless centres, I'll be honest with you. So I was really quite shocked by this, and she was so lovely as a person. And it turns out, because she moved into a different area, because she moved into a homeless shelter, she changed doctor, and the doctor immediately prescribed her HRT. And I remember seeing her, she got a job and everything. I saw her about 6 months, a year afterwards. She was skipping around down the road, saying, "Oh, Anita, we should meet up. I've started dance classes." And she was over the moon. And I think HRT and getting help with her emotions literally transformed her life. Unfortunately, it was too late for her marriage, and unfortunately it was too late for her children, and her community had basically, they didn't accept her anymore because they didn't understand her, and she didn't understand it. She just took new medication, and that's what really had an impact on me. Because even though I'd spoken to different types of women about the menopause and the disadvantage and discomfort of it, I could see with her scenario, if she'd had a different GP at a different stage in her life, that she might still be with her husband, might still be in their children's lives, and she'll be skipping at home, not doing a part-time job in a school, doing lunches, and living in a homeless shelter in her 50s. So that had a major impact on me. But also, when I started about 3-4 years ago, I organised conferences where I was lucky because as a community worker, I had access to all kinds of organisations. So the National Health Service were great. They were really supportive. So I had access to gynecologists, I had GPs, I even had a BBC menopausal presenter come along. I had a fitness trainer, I had some lived experience conversations as well, and I organised a conference. And the Borough Council gave me a free hall and everything to do it. And I made sure when I organised it that it was free. That's what I made sure it was free. So everyone volunteered their time, and everything I got for free, everything. I even got free pens. I was that type. Yeah. And I organised this, and I advertised it in the paper and everything, did press release and whatever. And every single seat in the room went, 100 seats went just like that. I had, literally went within a week or so, because this was at early 2019. So, and somebody from Wales came down actually to it, to the event. But what I found really strange, because it's organised by myself, a Black working class woman, but about 90% were white, and predominantly most of them were middle class. And I thought, whoa. I live in a town where ethnic minority representation is roughly about 1/3. And I thought, even though I'm well known within the town, and I clearly was promoting it through my circles or whatever, the only people who engaged in the conversation of menopause were white, predominantly middle class women. Even though I set it up to be really inclusive. So half of my speakers were Black or Asian. Mm-hmm. And I even had somebody do sign, because I wanted to encourage people from deaf to turn up. Yeah. And I promoted it in different demographic areas of lower socioeconomic groups, but the only people who turned up were predominantly white middle class, and that shocked me. That educated me, actually.
Do you think that that's still the case? Do you think if you did it today, that would still be the audience that you'd get, or is the message beginning to get out there? And if it isn't, what do we need to? What can we all do to help?
I don't fully understand it. My gut tells me that the conversation around menopause should be more in a community space rather than a private space. Because what I find now is that you have pockets of women who only stick with their own groups. I was hoping that the conversation of menopause in 2019 will bring women together to talk about menopause, but it's a worldwide issue. And I wanted women to share their own personal experience, but I also wanted women to fight to get the right that they deserved. I felt it was a fighting topic. I felt that the world had neglected women, but I found actually that trying to bring diverse communities in, they just didn't want to go in, or the communities that were there resisted. I mean, even though I started stuff in like 2019 and there was hardly anything around, I'm going to be truly honest with you, a lot of the middle class white women who turned up at my meetings at the beginning don't turn up anymore because they've got their own groups, which are delivered by white middle class women. So they don't want to interact with my group. Not all of them, but there are quite a few groups now. And therefore, even though I try to make it as inclusive as possible, they don't want to be part of my dialogue.
Yeah, it's really interesting. Yasmin, I want to bring you in here now to talk, because you had a really interesting take on both the experience of your aunties, but I wonder what your take is on that thing about, is this a cross-community conversation and how do we make it that way?
Yeah, it's so interesting to hear, Anita, because, you know, I see some of the same going on. But let me just begin with, it's an illustration of how serious this problem is. Yeah, I'm an intelligent, educated woman. When I went through menopause, and I was, I think, about 55, there were all these myths about HRT, you know, and they got to me. They really got to me because of the cancer fears. There was, it was almost a little bit like the whole vaccination thing that we've just experienced. There was all this suspicion that you know, our bodies were being used, and even I, who you know, reads everything, educates herself, was too scared. So I never took HRT, and in fact, I had not a bad menopause, and it was quite quick. But it just shows the power of fear as much as anything else. So that was point number one. Point number two, I think I so agree with the people who've spoken so far about the exclusion. Just the excluded include white women as well as Black nation women. Highly educated, rich Black nation women are fine. They know what to do. They're in the circles, so on. But I remember interviewing some working class women on a estate near me. They weren't using antenatal services, and it was quite frightening. They were scared of any state agencies because they felt that they were spying on them. So we got on to the menopause because often their mothers would be their helpers. It was the same fear. It wasn't just that they weren't being approached, but this relationship with the NHS, if you like, is a complicated one when people fear that they will be reported on or have their children taken away from them or whatever. It's a really complicated situation, I think, that I wanted to put on the table. But when I was growing up, and this is still going on, I was so impressed with and touched by the story of the Sikh woman, that Asian women and the women of color I know from working class backgrounds, there is this, as one of them said, I'm a woman when I can have children, and I cross the river and I'm no longer a woman. Now, I don't know whether she thought that or she thought others thought that, but she ingested that message. And the piece I wrote for Noon was about how I remember my mother and her friends being extraordinarily lively, wonderfully kind of jolly women who enjoyed life. Some of them were in terrible marriages, including my mother, but they had each other. As soon as they crossed this river, as they always used to say, this border, they thought of themselves as bastard, as old. They walked differently, if they walked at all, if they moved at all. And they split into two groups. Some of them were relieved that they no longer had to deliver sex. And they became matriarchs, and some quite vicious matriarchs, oppressing their daughters-in-law and daughters. Others just became so passive. It used to break my heart. They wore dull colors, they stopped putting on jewelry, and it was as if you were waiting for the end. And that is changing, but not nearly enough, because there are no words in any of the Asian languages for the menopause, for the vagina, for the clitoris. We have no vocabulary to discuss this in our own languages, which tells you something, doesn't it? Younger women, thank God, and I mean 30 upwards and maybe even 40 upwards, are now beginning to deal with this. But we still find that the older women are too shy, too ashamed, feel this is not something we should talk about to strangers or anyone else. And husbands, well, they don't understand anything, which is why this poor Sikh woman's husband reacted the way he did. And in a number of cases, particularly among Bangladeshi communities in this country, the worst thing that happens is as soon as a woman reaches menopause, in many instances, the husband goes to Bangladesh and brings back a younger one.
Yasmin, thank you so much for sharing that. So it's really sad. I'm looking at the questions in the chat, and so many people saying that's really it's really heartbreaking, which I think it really is. And I know part of the reason I wanted to do this conversation was because Dr. Nigat Arif has been our doctor at Noon on this all the way through, and she talks so movingly about what she saw in her own community, and she was the one who first told me that there was no word in any of those Asian languages for menopause, that it was just barren. And we shared today she's just done a great kind of TikTok video talking about menopause in her kind of in various different languages that she speaks. She's incredible, to try and get the message out there. So I think that, I mean, it's been pretty bad here, and people like Kate have been such kind of, and Carolyn have been such kind of pioneers in talking about it. But when you hear about the stories from the other communities, it really makes it clear how much work there is to do on all of this. So thank you both, Yasmin and Anita, for sharing those stories. Tina, I want to come to you now, because I want us to talk about some of the technicalities that you're really interested on how we actually get physically the kind of products into people's hands and how we can make that better. And I'd also be really interested to hear your take on what we've heard so far.
Yeah, so thank you. I'm fascinated. From my point of view, I do know that this is true, you know, because we see the statistics, and I also know that from my own experience, that, you know, in the same way that some working class women don't believe that feminism is relevant to them, I'm really conscious that we can't let this become part of that as well, so that they don't feel it's about them. And because of that, you know, in terms of reaching working class women, which we do, women that don't read The Guardian and, you know, aren't educated to argue with their GP, like Carolyn says, we have to change the access in primary care, because, you know, these women do see are their GPs, and they're who they trust. So our interest obviously came, you know, as an HRT manufacturer. We're a women's health company. That's all we do, women's health. We don't do anything else. And, you know, we started having these conversations with people, and, you know, and we saw the headlines saying HRT, you know, there's a shortage of HRT. And actually, you know, the big scandal, and I talk to Kate about this all the time, there isn't a shortage of HRT. There's a shortage of some HRT, but there's a lot of HRT available. But what there is it's not available to everybody. And somebody put in the chat just now about it's about choice, and 100% all of this is about choice. But in order to have choice, you have to have equality. you know, and that means that everybody, wherever they live, whether they live in Winchester, where I live, or whether you live in Doncaster, you have the exact same available products to you. And that is not the case. That is not the case. And that's because of local formularies, local red tape, where they put certain things on the list. They might not have looked at women's health actually, or HRT, for years and years and years, since the Daily Mail, you know, published the WHI study 20 years ago. Some formularies are massively out of date. So not all products are available for all women, and they're certainly not available free. So in Northern Ireland and Wales and Scotland, HRT is available free, and that's not the case in England. So I totally agree, this is about choice. But in order to have choice, you have to have equality. So we are really interested in battling with the Department of Health, who will not accept this discussion at all about the fact that there are formularies and that people are being denied HRT because of it, and to make sure that every woman, if she chooses to have HRT, she has the same choices no matter where she lives in the country.
No, I think that that's so important. And of course, one of the things that is part of the APPG recommendations is that every single woman at 45 should be called in by her GP and talked to about menopause. And we know that there have been huge problems with many GPs not having been trained on this at all. I mean, when I discovered that, I remember Kate and I talking about this, you know, a couple of years ago, and just being completely appalled by the fact that that GPs could not be trained on menopause when it happens to, you know, half the population. So I think that there's a huge kind of piece around, and I think part of this rising kind of loud volume around this is a real like kind of cry of fury from all of us who are going, well, why is there such a massive health inequality? This is completely wrong and completely unfair. Jen, I want to come to you about what you see kind of within your Netmums community and whether that echoes kind of some of what we've heard from on the panel.
Well, yes, this is really, it all strikes a chord. At Netmums, we also hear about perimenopause women, you know, and that coming on much earlier. Magali, I hope I'm saying that right, in the chat has said, I can't help feeling 45 is far too late for checks to start. And in a way, that's true. I mean, women can have early onset menopause or be in perimenopause for years. Obviously, you know, some people, if they've had certain treatments or other kind of health issues. So we hear a lot about those kind of things. I think I want to speak just briefly about both kind of parents and non-parents, like mothers and people who aren't mothers, in that as a mother, when I was going through menopause, that was when my daughter was turning, you know, 16. So we were at both ends of this kind of this hormonal scale. And it was really difficult, one, to be in a household that was kind of surging with hormones. But that kind of idea that it's a stop, it's the end of things. Like when your periods end, your life ends. That means that we're really defining women more than ever by our fertility and our hormones, rather than it being a normal, natural part of life that affects half the population. It's not a mistake when you go through menopause. Some people really have symptoms, some people don't have many symptoms, but a big part for us at Netmums is to start to understand and talk about this, even kind of within families, being able to talk to our children about what's going on with us. It's not something over here that mom has to deal with or that older women have to deal with, and let's keep it away from everybody else. That we need to be able to talk about it just the same way we talk about, you know, puberty or other changes that both girls and boys go through. Also, I did a little research when we were kind of putting this all together, and studies show that women with negative attitudes about menopause report more severe symptoms. So that's another reason that we need to really dispel any kind of fear or concern or shame around it, because those things actually can make it worse. Also, by bringing in menopause checks for everyone across the nation, it's a real moment to intervene with a lot of the health issues that can come up around that time for women, some related to menopause and those hormonal changes. High blood pressure, diabetes, cardiovascular disease. Women in their 50s, women going through menopause, all become a lot more likely to develop those problems. So in a way, it's not even just we want all the ladies to feel more comfortable, so they're not having those hot flushes. It's like, yeah, there's so many benefits kind of overall to society with intervening, keeping everyone healthy, and turning the conversation around. So whether somebody decides to have children, doesn't decide to have children, that there's this idea that, yes, it's just a part of life. Let's just all talk about it and normalize it.
Yeah, thanks, Jen. I think that's really true, and the kind of inter-family bit is really, really important. Andrea, I'm going to bring you in here as the kind of younger member of the panel, kind of younger voice. I really hope by the time that you get to like 40, 45, things are a bit more fixed. One of the things that's just come up on the chat is there's someone who's went to see their doctor and they asked for HRT, and the doctor said, go away and research it on the internet for a week and then come back and tell me which version you want. And as Tina's just very rightly said, no one would say if you needed antibiotics or treatment for your cancer or something that you should go away and look at Dr. Google and then come back and say what the internet said. So I think that there's a real kind of horror out here about all of this, and that's coming from an actual GP. So tell us what your plan is and your vision for what this might look like in the future.
Yeah, thank you, Eleanor. I accept that I am an outsider here, both in age and accent, and so I'm grateful for being included. I think, so I run Vira Health, which is a company focused on women's health, and I came to this after a long career in kind of very corporate life, sitting as the only woman in a room. I was like, what's going on? This is incredibly frustrating, which a lot of people can share. And I ended up having a bunch of conversation with women in their early 50s about why they had opted out of corporate life, which is an incredibly luxurious position. And we started talking about menopause symptoms and how that was affecting their life. And I thought, if women of means and access and money and education are having a tough time, then the gap that must exist for most women is monumental. And so what can I do? I thought, and in 2021, I recorded a TED talk on the link between gender inequity and menopause, which I kind of threw into the ether, a bit nervous, to be honest, about the response. And it was actually really positive, but from a level of almost clueless, the responses were all, I had no idea. And I thought, there is an information piece here, like men, they're not all terrible. They do want to know whether their sons or father, whatever. And workplaces are not all horrible places. Some are, but actually a little bit of guidance on how to be menopause friendly or supportive is helpful. But fundamentally, access to care is the thing that matters. And if more women cannot get the information and guidance about what's happening in their body and what treatments are available in language that they feel comfortable and excited by, like speaks to them, whether it's from a friend or from a trusted source, however that is, that information piece has to be out there. And then also like actual access. How do you speak to a doctor and get drugs if they're appropriate to you? And so we launched Stella, the app, which I appreciate your comments, Kate. Yoga and nutrition are not a solution. But Stella, the app, kind of helps with information and guidance, like what can you do if it's not medication? And then we're in the process of launching an online clinic. And it's not a solution for everyone in the sense that the NHS needs to drive here, but it is about making as low cost private care available as possible across the country. So wherever you are, you can access high quality menopause care. And so I feel really excited about this and really focused on how we make it as accessible and wide as possible. I'm only going to say one more thing. We have a grant from the UK government to expand our product to make sure that it isn't just, as I say, North London mums. And what I was really excited about this summer is we ran a series of workshops and spoke to hundreds of women about menopause, about how they came, what information they're looking for to make the decision about their treatment. And what I found is we ended up grouping everyone by symptoms, so not by ethnicity, not by anything else, but by symptoms. So everyone who's kind of really miserable about their sleep or really miserable about weight gain or whatever it is. And that created this kind of shared experience and conversation where we really were able to have what were great, I mean, meaningful, great's probably the wrong word, but meaningful conversations. And I think our understanding of how to reach more women has been a lot better. So I'm optimistic. I think the news and the chat is important, and it just has to grow from there.
Yeah, thanks, Andrea. Carolyn, I wanted to talk to you about, because when we were talking, you were talking about this doesn't necessarily have to be delivered by GPs.
No,
this can be a.
Yeah, I mean, I firmly believe that we have a whole army of people out there who are capable of diagnosing and prescribing, and that is women's health nurses and pharmacists, providing they are prescriber pharmacists and provider women's health nurses. I mean, I've heard of some good practice in some places where the doctor surgery has been overwhelmed by a large amount of women presenting, and all of them with similar symptoms. The doctor's not really understanding it. So they funded the women's health nurse to actually do the menopause training. And now she runs a clinic, and she has her own database. She's got her own receptionist, and she just does all the menopause stuff. Now, she also does the coils, and I think that's where she gained her insight from. But if it's an issue which she feels is not menopause, then obviously they get referred back to the GP. But there's no reason why every GP cluster should not have at least one person trained up to identify and prescribe HRT, provided they are prescribers. It's not rocket science. Once you've got the information and the knowledge and you are honest about it, then it's pretty obvious if it's menopause. And I think it's really important that we utilize what skills we've got in society.
Oh, it's really interesting, Carolyn, that you say that, because I know that what Andrea is doing is basically a kind of, quite a lot of it is quite a kind of complicated algorithm, isn't it? Around kind of what, will you tell us a bit more about your research as well, and some of the treatments that you're looking at?
Absolutely. So what we've developed is an online questionnaire. It's between 60 and 90 questions, and over 80% of women complete it. And we've really been thoughtful about language. And so what that means is that a woman on her own time and privately can sit down and go through and answer these questions, can call and ask if there are any questions or confusion. And then what that allows us to do is generate the best treatment option for them. So if they are low risk, HRT applicable, great, then we have a process for that. If they need to speak to a GP or a specialist, then we have a process for that. And we actually do have a pilot with one small part of the NHS to see if this could be a front door for primary care. So not everyone is going to want to do this online. Absolutely not. But some women will, and the ability to do that, or in an area where you can come and there are a couple of computers and a bit of guidance. I just think that having more than 7 minutes and having, the time and the headspace to do it is a really important thing, because as you say, it just requires a system that can receive that information and then make the right course of treatment.
Yeah, thanks. Kate, what do you think about that?
I was just thinking of some solutions here, and I was watching what Karen Arthur, who is an Instagram Menopause Fast Black and also does some fantastic podcasts, and what she was putting up in the chat, and also there about the distrust of some communities of drugs, of HRT, of medical people, of all these things. And I've been researching about the pill, and obviously the pill was tested on Black Puerto Rican women in huge overdoses. They didn't get pregnant, but some of them died. And that's in people's heads. And there's a whole history like that that is sitting there silently. And a lot of people have that kind of knowledge. And the way to overcome it in some ways is what the Menopause Charity are doing, which is they are training champions from those communities. So they're not necessarily doctors, but they're people like us who are menopause warriors, and they speak the language. They are working within the culture and the complexity and the families, and are really going in. And it costs a lot of money to get people trained, but that is one of the things the Menopause Charity were doing. And I was also talking to Dr. Nighat Arif the other day, and she was saying in the South Asian community she's working with, people are going door to door to talk to women. So it's like the Jehovah's Witnesses. Hello, would you like to talk about menopause? But if it's someone from your community or your area, then that is less frightening, and actually going into people's houses. So it's a huge amount of on the ground work. And one last quick thing, and Lavina put a thing in the chat there, which is that we're talking about 45. And as far as I see from the studies in India, because of course nobody's bothered to do any here, the average menopause recently in India was studied to be 46. And that's the average. So what on earth are we looking at in our complex communities in Britain? It could be all sorts of ages, and people aren't thinking in that inclusive way. And we've got to think about it all the time.
Yeah, no, I think that's really right. In fact, we were looking at some, in fact, Yasmin put in her piece for me, some research from America, which shows that actually menopausal symptoms in people of colour are often much more severe and start earlier. Yasmin, do you want to talk to that a bit? You were looking at the data.
Yeah, and I must thank Karen. You know, she's my heroine around way past menopause, but I think she's just such a phenomenal woman. So I need to say that to you, Karen, and you are having such an impact. But it's medically proved. We haven't got this research happening on any scale here. We're so behind all the time when it comes to health and ethnic disparities. Either there's a denial or there is an irritation sometimes. And we know from everything, including COVID, that there are disparities. And I wish we had some of the research that they have in the United States, and which is part of the texture of the health professionals, but it isn't. And the other point I did want to also raise, that we've mentioned in passing, educating men. It seems to me that in all the kind of Asian communities to whom I'm close, the men are clueless, kind of don't want to go there, don't want to talk about it, and yet they have the power in the family. So how they behave towards menopausal women in their family kind of depends, creates hierarchies. And I really think we need some kind of work on talking to men of all races, because in a kind of highly sexualized society like ours is, menopause does become something that throws you into the waste bin. I remember a nurse who was talking to me when I was coming into, just out of that awful initial period of menopause. She asked me if I had sex. I said yes. And she said, really? I said, yes. Why is it such a surprise to you? She said, it's not normal.
Yes. Well, I mean, and that's difficult too, but also we hear on Noon about lots of different kinds of experience of kind of sex and kind of sexuality kind of through menopause, that for some people they actually get a kind of a sexual surge. For other people, they still really love their husbands, but sex becomes really uncomfortable and painful. I was talking to a woman the other day who said that she'd always had a fantastic sex life, and that recently, since she'd had such terrible vaginal dryness, that it kind of wasn't okay anymore, and it was causing terrible problems with her husband. So I think that also what lies behind all of this is so much kind of personal heartache and grief. I mean, we heard that from Anita with the story of the poor Sikh lady, but there are so many, those stories are amplified all over the place, and that's why it's so important that this is tackled. I mean, for me, it really is the kind of, you know, one of the last bastions of feminism, sorting out kind of these problems for kind of women in midlife and beyond, and also recognizing and valuing the lives of older women enough that this gets sorted out, that we're not just seen through that kind of patriarchal male lens of when you're fanciable and fecund, you're worth kind of worrying about, but as soon as you're not, society writes you off, which is also why there's been such a terrible inequality in how this is treated across all cultures. So I think that that's one of the real things that our generation of women kind of has to kind of fight about, and that I really hope will change in our lifetime, and that these kind of discussions can start bringing about. Carolyn, I'm really interested to know for you what it's been like speaking about this in Parliament, and you've been so brave. I remember, and we were laughing the other day about saying the words vaginal dryness a lot, particularly publicly. So tell us a bit about your experience and what you think needs to happen.
I found that, no, I mean, yeah, there was a hesitation the very first time I was going to use the word vaginal dryness in Parliament, that we're gonna have sort of a deep intake of breath, and everybody was going to say, oh, you can't say that. But I thought, no, it's got to be done. And I actually found that there was nobody there who didn't actually embrace what I was trying to do. And I've always found that the men in this building are far more receptive to listening to what we're going to say than I thought they would be. In fact, some of them have shared really heartfelt stories about their wives. One Tory MP told a story about how he vividly remembers his mother being taken away to an asylum when he was a teenager, only to discover that she was menopausal and not insane. And, you know, all these things. And I just found I get a lot of strength from when I do speak to colleagues, because the number of male MPs who've come on to me and said, I can't thank you enough for the work you're doing on this. It's either their wife or the constituents or their sister or somebody they know has benefited from the fact that we are talking about it in here. And once you talk about something in the House of Commons, it becomes a thing, doesn't it? You know, it's on the political agenda, so people are not embarrassed to talk about it. And I talk about it all the time now. There's not a day goes by. Whatever questions there are, no matter what policy department is answering questions, I would have put in a question about menopause to that department, whether it's Home Office when I talk about the consequences of bad decision making and women potentially ending up involved in the criminal justice system, to what the treatment in prisons is, to what the Department of Business Enterprise and Skills are going to be doing to help women stay in work, to DWP about the dependence on benefit when somebody gets involved. They have to leave work because they can't work with the menopause. There's not a department. I mean, domestic violence increases during menopause. So I've talked about that, and we've got a debate in this place next Thursday, not this Thursday. A week Thursday, it's a backbench business debate for info, and I've got a 3-hour debate, and I will be taking that opportunity to talk about everything menopause. And again, you know, saying about every single social policy area where we need, and there isn't one that's not included, we need to be talking about this. Every policy decision that's made, menopause should be in there, and there should be provision for it. Otherwise, we are doing a grave injustice to women right across this world. But if I can just go back to men, since I've been talking about menopause, even when I go to the football, I have men stopping me and saying, you're the menopause MP, or my wife loves you. I do a big I'm really thinking about feeding people. I really worry that people in my constituency who are not very well off struggling with food, and we feed kids through the summer and we feed people at Easter, and every Christmas we do this big hamper campaign, and part of the fundraising for that is I go to the rugby game and the football game with a bucket, and we do like a bucket collection. The number of men who came on to me last year and were putting tenors in the bucket because we spoke about this, and their wives had suddenly realised That's what's wrong with me. And it was like a thank you from these men to say, thank you, you've helped my wife, but you've helped me. And it's just brilliant that people are receiving it the way they are. But you know, every woman is a menopause warrior, whether she's 5 or 50, because at some point or other it's going to affect you, your relationship, the woman around you. It's going to affect you in some way. So all power to you all. You were absolutely fantastic. And I too am a big fan of Karen Arthur. Big shout out for Karen Arthur.
Yeah, no, big shout to Karen Arthur, and thank you so much for being kind of in the audience, Karen, and for all of you amazing people who are out there. The quality, the richness of the chat is amazing. We're going to capture that. Jen's going to make sure that we capture it, and we'll put it all up on Noon so you can see, because there's so many amazing links and kind of suggestions and thoughts. We could definitely kind of go on all night. I could totally see that. And one of the things that's been raised, which I think has been really moving in the chat, is about the prevalence of suicide for women at this point, that there's a real kind of a spike in that. And of course, that's something that's not really talked about very much. And also just this whole thing about how menopause affects the whole of families, you know, that when a much beloved kind of, you know, mum or auntie or whatever goes on the blink and is feeling dreadful, then that has a knock-on effect on everybody. And a really sad message there too from somebody who's saying that she's been feeling awful for the last 10 years in the corporate world. She's just managed to get a prescription for HRT, had to go private. So I mean, we're really not there yet. So Carolyn, what do we need to do for the APPG suggestions to actually happen in law? One of the things that we've done with all of you who are on this panel is we've got this petition going, parliamentary petition, which is to make menopause a quaff, which is to maybe that it has to be compulsory for everybody, for everybody to be summoned in to talk about it, and that GPs have to take it seriously. So will that help, Carolyn? We haven't quite managed to get it live for today because of the Queen dying. There was a huge delay on all the menopause petitions, but there will be. So that's one thing. That
for those who don't know what a quaff is, a quaff is a condition which is incentivized. So doctors are paid money to actually gather data, and it's about second guessing what conditions are going to be prevalent in that community in years to come. So say, for example, if you broke a foot and they send you for a cholesterol test, you'll think, why am I being sent for a cholesterol test? But it's because they're trying to second guess that in X number of years' time, how many people may potentially have heart disease because of excess cholesterol. So having menopause on the quaff, which means that every woman would have to have that conversation with the GP, which means that those GPs who are already qualified would have to learn more about menopause in order to have those conversations. That's really important. A national formulary is essential because currently, like Tina was saying, you have some medication which is in short supply, but there is not a shortage of HRT, it's some HRT. So we need a national formulary so that when doctors look online as to what HRT is available, they get the full raft of HRT that is available. That's essential. And as long as we get support from menopause warriors in supporting us in everything that we do, then I can genuinely then go into a debate and say, we now know that, especially when the quaff petition hits the Westminster Hall, because it will, because if you get enough, 10,000 on a parliamentary petition means you get a response. 100,000 means it has to get debated. If it has to get debated, it has to get talked about. It gives us an opportunity to say why, and it gives me then the opportunity to put pressure on the government to make it a quaff. You know, the free prescriptions for women in England, we didn't get that. We had a promise of a reduction, a once annual year fee for women in England, but that hasn't happened yet. And we've had some drivel about, it's a computer system, and they can't get the computer system. It's nonsense. Why do you need a computer system to actually give a woman a piece of paper that says you're entitled to an annual fee for for your HRT. I mean, maybe I'm naive here, but you could actually write the word HRT on that piece of paper, or you could actually print it in a different colour. It cannot be difficult. It's all about stalling. And I think as long as the government know that we are making a noise and we're not going to take this lying down, and we are demanding, and it's not even equality, it's normality. You know, we 51% of the population, all we want is to be treated normally, that we can live normal lives. So as long as you all back what we do and you sign these petitions and you keep making a noise and you just make your voices heard, we will win this argument, because I'm not going anywhere till I've won it.
Carolyn, thank you so much. I think that's a round of applause. They're all cheering on their Zoom calls all over the place. I can hear various cheers around my own house. And so I think that's it. So our petition to make menopause a QOF will go live, I think, in the next few days. We will share it kind of everywhere, and everyone on this panel's promised to share it. Jen's going to share it with the whole of Netmums. Tina's going to do it. Kate's going to do it. The menopause charity are going to do it. Carolyn's going to do it. Andrea, Yasmin, Anita. So I think we'll all get out there and share that, because that really is something tangible. When we went into this, Carolyn and I were talking back in the summer about what we can actually do. I remember asking Louise Newson that question at the Davina party and saying what would really make a difference, and she said put it on the QOF. So we, you know, this is really it, and it's on that APPG suggestion, but it's up to all of us to really keep the pressure on so that it actually happens, because there's so many proposals that parliamentary committees come up with which never get enacted. So I think that that's something that we can all do individually to keep that pressure on. And if everybody on this call tells every other woman they know to sign that QOF petition, we can really make a difference here. So that's our strong hope. And I'm really sorry we don't have it up for you to do today, but that was because of the poor Queen dying. So that's not really any of our fault. But I just want to say a massive thank you to all of our panel. We're over our hour, and I know that Carolyn definitely has to go. Thank you so much. You've all been brilliant. We could all have talked kind of for much longer, I know, but I think it's been a great discussion. Thank you for tuning into Noon. Thank you for all of you for coming, and we'll make sure that we do this again and we keep the pressure on the QOF. And big thanks to all of you for being such amazing menopause warriors.